Hi, I'm Lisa Townsend. I'm Surrey's Police and Crime Commissioner, and I'm also the Association of Police and Crime Commissioners lead for mental health. And I wanted to talk to you a bit about something that's been in the news quite a lot over the last few weeks, and in particular the last few days, which is how police deal with mental health cases. Now, you'll have noticed that there has been an awful lot of talk, and I know that it's made some people really worried. This, unfortunately, hasn't been helped by some of the commentary on Twitter. So I want to take the opportunity just to hopefully reassure you a bit and explain a little bit about what's happening in the wider space. So Humberside Police Force have for 3 years been using something called Right Care, Right Person. Now this is really, really important, and what it means is that somebody experiencing a mental health crisis should be receiving the right care from the right person, and that won't always be a police officer. Now, one of the things I want to reassure you about is that you or a loved one or a friend or somebody you come across is experiencing a mental health crisis, and it means that somebody is in danger of getting hurt, whether it's that person or somebody else, the police will always turn up. The police are always going to turn up if somebody's life is in danger. That is not going to change. But what does need to change is making sure that somebody who is experiencing a mental health episode, whether it's a crisis or they're just suffering from mental ill health in some way, does get the right care. And that won't necessarily be from a police officer. It will almost certainly be from somebody who is medically trained to deal with that. For anybody who's got a friend or family member or themselves who has suffered from mental health, you will know very well that it needs a trained medical professional in order to deal with it. Now, police officers aren't trained to deal with it. And one of the reasons for that is that police officers do something that nobody else can do, and that's to prevent crime and investigate crime and solve crimes. Now, in the same way that we don't ask our health professionals, we don't ask our doctors and nurses to come and investigate crimes, nor is it right that police officers are spending as much time as they currently are dealing with mental health patients. It stops us being there for residents when you need us, but it also means that the person who is experiencing that health crisis isn't receiving the right care from the right person. I want you to know that if you or a loved one or anybody that you know is experiencing a crisis, the police will be there. But I am going to work really, really hard with both local partners here in Surrey and nationally to make sure that everybody is getting the right care from the right agency. And that is the most important thing. This is not about the police saying they're not going to support people. This is absolutely about the police saying that we believe that those experiencing a mental health crisis should be looked at by the people best qualified to support them. And as always, if there's anything you want to get in touch about or you've got any questions, please do not hesitate to get in touch with me, and I would be delighted to answer further questions. Thank you.